Welcome to the International Careers course in Global Health and Supply Chain Management.
Could we move to the next slide? There we go. All right. Let me introduce a global professional and a close friend of mine as well, and a global figure from Zimbabwe, Mrs. Ropa Fadzai Hove. She is a senior advisor to Empower School of Health, is a pharmaceutical policy and regulatory expert. She's a speaker and trainer who has held leadership positions at national, regional, and international levels on procurement and supply chain and pharmaceutical regulation. She's also the immediate past director of pharmacy services in the Ministry of Health and Childcare in Zimbabwe. She's a pharmacist, holds a bachelor's degree from University of Zimbabwe, a master's degree from the University of Bradford, the UK, and a postgraduate diploma from the Empower School of Health on procurement, global health procurement and supply chain. It's an honor to welcome and introduce the moderator. Ropa, the floor is yours.
Thank you, Paul. Some housekeeping arrangements this afternoon. We request that you kindly mute your mics and turn off the video. You can only turn on the mic when you have requested for the floor. Please ask your questions using the chat box, or alternatively, you can raise your hand. You are also encouraged to participate in the polls so that we know more about your interests. And it's quite encouraging that this is really an international webinar. So we really would want to know where you are at and what your interests are. The webinar recordings will be available on the Empower School of Health YouTube channels. The slide deck will also be shared with all participants, so relax and just have your full concentration as you will get the materials after the webinar. And at the end, kindly fill back the feedback form at the end of the webinar so that we can continue to improve. Please turn on your camera for better engagement for the panelists when they are presenting their presentations. Please mute your microphone when the other speaker is speaking so that we will not have feedback. And I am seeking your indulgence, panelists, to adhere to the scheduled timings. The webinar objective this afternoon or this morning is to explain the importance and benefits of an international career in global health and supply chain management. It is also to launch the partnership between the Harare Institute of Public Health and Empower School of Health. Now we can take poll number 1.
Is the poll still going on?
Yes, people are
Yeah,
polling.
this is poll in
Yeah,
progress.
yeah,
Okay.
poll in progress. 41 people have already.
What percent? What percent completion?
70% completion has happened, and so just wait for another 15-20 seconds, and let's see. We can show the results.
So we encourage everybody to participate in the poll.
Yes, so we are almost done, over 70%, and we can show the results. We can stop the poll and show the results.
So in terms of the gender, today we have 60% male and 40% female, not too bad. In terms of the age range, 16% are less than 30 years, 42% between 30 and 40 years, 31% between 40 and 50 years, 11% older than 50 years. Geographical region, the majority are from Zimbabwe, 38%, Southern Africa, 7%, Central Africa, 16%, West Africa, 18%, outside Africa, 22%. Academic background, from medicine and dentistry, 2%, pharmacy, 64%. We do not have nurses yet. Any other health sciences, 11%. Management, engineering, or other professions, 9%. Supply chain management, 11%. Other, 2%. Educational qualifications, diploma, 9%. Bachelor's, 27%. Master's, 53%. PhD, 11%. Where the participants are working, Ministry of Health or other government bodies, 24%, UN organizations, 13%, donor organizations, 2%, international or national NGOs, 20%, private sector, 38%, others, 2.2%. So it is quite varied. So as we proceed,
So I should just add, someone rightly.
Yes, come in, Paul. Mm-hmm.
Sorry, Rupa. I'm so sorry to interrupt. Someone put in the chat that we had forgotten to include a very important geographic region of East Africa in our poll. And so that's an oversight from our part. So team, please note that for next time. And also to highlight, we have somebody all the way from Solomons, but that's another point altogether. East Africa was not represented, our apologies, so we may have lost some numbers over there. Okay, back to you, Rupa.
Well noted. Thank you, Paul. As we proceed to the next speaker, his name is Professor Paul Lalvani. He is a founder and director of Empower School of Health, which was founded in India and is present in more than 10 countries. He is the deputy chair of People That Deliver, which is hosted by UNICEF. And he's the founder of the Center for Digital Learning in Global Health. He is the former head of procurement and supply chain based in Geneva, and UNICEF gets far to you, Paul.
Yeah, your voice is breaking up a little bit, and I think the introduction is long enough, so I will pick it from here. Thank you so much. I should also let the team know that we need to update a few points on there in terms of the PTD. So Rahul, please correct that as well. As you know, there have been some changes. Okay, wonderful. So wonderful to be here with all of you. We have quite a varied crowd where there are several on Facebook watching live, and there are several on Zoom as well. So almost 100 from what I'm informed, and a large percentage of that is from Zimbabwe. The other thing to highlight is 60-40% of women, 40% men, 60% is actually, it's still not 50-50, but it's a good number in terms of moving in the right direction, because all our previous webinars have been around 25% women. And it's good to see more and more women being involved in global public health, and also specifically in public health and supply chain as well. So next slide, please. Few slides. I'll just spend a few minutes for those who don't know about Empower School of Health. We are a global organization headquartered in Geneva, Switzerland, and our main focus is large-scale capacity building, working with ministries of health across more than 100 countries. We have some friends from Solomon Islands, which is in the Pacific, and we work with another small island, Haiti, all the way in the Americas, and many countries in between, and in almost every language. And we do capacity building. We do not only in procurement and supply chain, but global health in general. And one of our main areas of focus is seeing large-scale learning at low cost through digital learning. That's what we're really known for. Okay, next. Many partners across Africa and Asia, so we never work alone. And of course, in this particular webinar, we're also launching our partnership with the Harare Institute of Public Health, a very well respected organization working very closely with the ministry, with leading technical people, and all the way to the last mile at the grassroots. And you'll hear more about them as well. It's an honor to partner with them. Next. In terms of our areas of focus, we do a lot of work in global health leadership, working with the CEOs and the directors and the health secretaries of countries in building their leadership, management, negotiation capabilities. We, of course, work in global health supply chain. This is one of our core areas of focus, where we are really well known in all the different disciplines and other areas as well. Next. These are some of our key advisors and staff members. The one to highlight, we have most of them are either former UN staff or former ministries of health staff at the director, deputy director, or even at the secretary health level. But one of the most important is His Excellency, the former president of Ghana, President Kufuor, who has worked closely with, guided, advised, and been present in many of our leadership workshops, working with senior leaders. Next. So let me shift to the webinar topic at hand, careers in global health and supply chain. So I noticed that 66% of you are pharmacists. But what's interesting about global health and supply chain is we have people coming from engineering, from management, from legal, from financial, to pharmacy and health sciences. Everyone is able to work in this area. It's a matter of bringing your capability level to a point where you would be, you would have the necessary training and education, and then the necessary work experience to work for some of these organizations, including, of course, and most importantly, the Ministry of Health in your own country, international NGOs, and others as well. So we're going to walk through some of the aspects of how to build a career in global health and supply chain. I also noticed, by the way, that half of you, almost 50% of the audience is somewhere between 30 to 40 and 40 to 50, which means plenty of room to learn and grow and shape your career. I was 30 years old when I joined the UN system And then within that, worked with the World Bank, UNICEF, WHO, global funds, either full-time or part-time, eventually leaving them to launch the Empower School of Health. So you've all seen the SDGs. Our, of course, focus is in the area of number 3, which is health and well-being. Next. And within that, you will notice that what we've done is within health, there are all these different targets, groups, scope that are there, and this is adapted from the WHO schematic, which looks at the different aspects of health within the SDGs and the targets they have. Next. Nearly all of them have some element or aspect which require reliable, uninterrupted, and supply of quality assured health products, whether they are for vaccines, oral rehydration salts or ARVs, or as what everybody's struggling with right now, COVID vaccines. Okay. Next slide, please. Right, so if you look at what is the status of global health supply chain, and in terms of from a human resource point of view, nearly 2 billion people across the globe do not have regular access to essential medicines. They have some access, but not regular access. And there's a reason for that. And next slide, please. Of course, a lot of it has to do with resources and capability, but one of the major challenges in global health supply chain is the lack of human resource capacity. If you look at what is required, and some of these numbers have been analyzed and adapted from WHO, the human resource work that they do, HRH, Human Resources for Health, is 30 to 70% vacancy rates in many, many countries. And then you have that leads to available human resource capacity. But if you look at effective human resource capacity, do the staff have the training and education, and you'll arrive at a number that's even smaller. So countries are struggling, and globally, there's about 54 million health workers that need to be trained, and they need to be trained again and again on a regular basis. Policies change, people change, products change, and it's not easy to keep them updated and informed, especially when you have such a large number. Next. As we mentioned, one of the major challenges is human resource, and this is from the WHO document. Next. But why is there a limited human resource capacity? It's because there are very few, whether it's schools of pharmacy or procurement or those teaching procurement and supply chain in a manner which will get you ready for launching your career in this place, to have credible capacity building. And it's not just about, I know this is written about pharmacy and pharmacists, but the same thing. When people learn supply chain, many of you are working in supply chain, but at the same time, it gives you there are many organizations like CIPS, CILT, or you have a master's in supply chain. It's how do you then bridge from there to global health and public health? And the area of work which HIPH and Empower is focused on is bringing together, combining the understanding of public health and supply chain jointly and together, which is really fundamental. Next. Next. So if you take a look at just roughly, to give you a sense, every year, just click again, you'll see another number. Almost 500 products are being introduced. This number is even higher on an ongoing basis. This is the current pipeline, and this is 2 years old, so the numbers have gone up. And you need to keep learning new information on an ongoing basis, which is of course not easy. Next. It should be 1.7 million deaths due to COVID. I don't know where 2 point is that. Can you double check if that number is correct? I'm not sure. Last
yes,
I
Prof.
checked. Is it?
No, Prof, I checked it. The number has increased to 2.7. Let's.
Okay, please do double check. But basically what, I just mentioned it in the group here right now. What is absolutely, and again, it's growing and growing and growing. And this is not the first pandemic that we have. As you can see, there's the Spanish flu, the Russian flu, and at the same time, HIV/AIDS that killed 25 million people up to the present time. That rate has gone down. When I first joined the Global Fund, there were 3 million, and this is what, 15 years ago, there were 3 million deaths per year from HIV/AIDS. We have managed to control the death rate significantly. Tuberculosis was 2 million. That's come down significantly. And malaria was 1 million, and it's much lower now to about 500,000. But there will be new pandemics and there will be others. So how do we prepare ourselves? This will continue to stress supply chains on an ongoing basis. Next. So many stakeholders are involved with global health and supply chain. So as you plan your career, as you plan to see where you might want to work, which area, what skills you need, there's product development and manufacturers, there are donors, there are regulators, Ministry of Health, procurement and supply chain, and advocacy. Nice to know that there's a very large number of people with a communications background, people with media background that are working in global health and supply chain, because that is a key area. People need to communicate. So don't think you need to be a pharmacist or a doctor or an engineer. There are many other skill sets as well. And if you have a science skill set, then to the science, bring in a complementary additional skill set as well. Next. You would have heard of some of these organizations. We're working with almost all of them in one way or the other. Either we partner with them, we do projects with them. Some of our graduates and students support us to work with them, etc., etc. A clear example here being our wonderful moderator, who's an Empower graduate, who has been one of the leading people at the Ministry of Health. I first met her almost 17 years ago in Geneva, where she was part of an international committee with the Rollback Malaria Partnership. We were on the same committee and working group. And today she is guiding us and advising us in the field, in the countries. So, and she's supporting us on a Global Fund project and some other projects as well. Next. So within, as you do this, we have a specific course on international careers in global health and supply chain. And we guide you through what it is that you might want to do if you would want to work in your country, or you want to work in the region, or you want to work globally. I started off working, I'm originally Indian. I grew up in Africa, and I studied in the UK and the US. I somehow found myself in the UN system, and it wasn't easy. I knew I wanted to do something like this, but I didn't really know what it was. And remember, this is, we're looking at 1995. So this is pre-LinkedIn, pre-Facebook, pre all of that. As you can see, I've got quite a bit of gray hair, but you have the advantage. You've got a network, you've got social media, you've got so many different opportunities. So learn about them, see how you can leverage them, understand what it is that you'd like to do. And it may not be clear, but at least you have a direction that you want to move in. And this course will help. It's a short 2-month course, 1-month course, which will guide you in the direction that you may want to take later on. Next. There are also some quite a few free courses that we offer. So if you're not quite sure what you want to do, where to do it, start with the free ones. They are co-branded with UNDP. We have another one which is a bit more complex with the Global Fund. So try those. And there may be others as well that you can get. And once you feel that this might be an area, then jump in. Next. These are a list of courses. We're about to launch a master's degree as well, in addition to the ones that we have, which is a postgraduate diploma, multiple diplomas, and certificate courses. And these are all approved by the Pharmacy Council of Zimbabwe for those who are in Zimbabwe. Next. This is the course, and you can go on our website to have more details. And this is also being offered jointly in collaboration with Harare Institute of Public Health. Next. Brief information about the postgraduate diploma. Again, you can go to our website. Next. It's in English and French. There was a lot of demand for the Francophone countries. And finally, I think it's the last slide. That's our web link. You could go there for more information. Thank you. Next. Perfect. Thank you so much for your time. And I hand it over to our moderator, Ropa. Thank you so much.
Thank you, Paul. I will not switch on my video as I introduce the next panelist. This is Dr. Amos Marume. He is an experienced senior lecturer and researcher. He's also the principal of Harare Institute of Public Health, and he is also with the University of Zimbabwe. He has significant experience in academia in areas key in public health, such as pharmacology, pharmacoeconomics, supply chain management, leadership, and entrepreneurship in biomedical sciences, among others. At HIPH, he is championing Zimbabwe's only affordable and accessible institution of higher learning that is focused to advance public health in sub-Saharan Africa and beyond. He has helped design several curricula for training, supply chain management, public health, among other areas at various levels in the provision of health. He has also significant experience in retail and hospital pharmacy, leadership and entrepreneurship, among other areas. Over to you, Dr. Amos Marume.
Thank you for the introduction. Can I have next slide? Yeah, as you can see, I would want just to, I will not talk much about supply chain. I think Prof did quite well, and also the panelist who is coming after me. I will talk more about HIPH, just a little bit about HIPH, just as we are launching the partnership with Empower. As you can
We seem to have lost you, Dr. Marume.
So I think I can, my network is not stable, so I'm trying to use my phone at the moment. So I think, am I now, are you hearing me? Hello?
Yes, we can hear you.
We can hear you. You can switch off your video if
Yes.
your connectivity is not stable.
Yeah, it's not stable. Can I have next slide? Okay, so just as a brief background, HIPH is an institute that is registered with the Ministry of Higher and Tertiary Education through our Manpower Development Act under the Higher Education Examination Council, EXCO in short, and really its roots, HIPH comes from the School of Pharmacy as early as 2007, which we started there as Farmers Skills Training and Development Unit. So we have since broadened the scope to include all key issues, as you probably have heard in the introduction, to do with public health. Can I have next slide? So some of the courses that we are launching and in collaboration with Empower include those listed there. I think Prof also touched a lot on this as well. Can I have next slide? So the vision and scope for HIPH is really to try and improve public health in general. And what we hope to do as HIPH and in collaboration with Empower, as highlighted, is to introduce these expert areas in public health, supply chain being key, to the very low levels of public health professionals, that is, people who can actually stay in those, for example, rural healthcare centers. We would want to empower those and train those, and as well as going up to highly specialized professionals. So we also want to improve supply chain in this case and other key areas of public health in terms of research and development, by ensuring also that these key or low-level professionals, if empowered with these specialized areas, skills in these specialized areas, it also means the quality of information that we can get from those various centers dotted around the countries in rural areas in particular can actually really improve decision making at the ministry or government level for the purposes of improving health in general. So in short, we want to bring specialized areas, skills and techniques to the right grassroots and as up as we can go. And can I have next slide? Thank you. This slide is introducing some of the courses that we have currently accredited by HEXCO, which are relevant really. As you can see, there is a diploma in public health supply chain management already accredited with HEXCO, and various other key programs for public health. Can I have next slide? So the partnership really, as HIPH, we thought it was not necessary to reinvent the wheel. Empower, I think all of us have seen it, that it is widely experienced and well able to help really anyone in terms of global public health. So we thought of collaborating as we are launching the collaboration that we are launching today. We bring what we think, and we learn a lot from Empower for the purposes of having graduates that really can do something, can really change, can really improve. Because as I've said earlier, the objective here is to see how we can improve public health. You know, it's not a good sight to have year in, year out cholera in the capital city. You know, it's something that should really not be a major topic to talk about. But well, it's highlighting some problems within our public health system, which we hope to address with programs tailor-made to suit our environment. And indeed, I encourage many sub-Saharan African countries to look into those areas and see how they can introduce these programs that are really unique and have a context for the local setting, such that whatever a graduate is empowered, it will likely improve the public health for the area concerned. Thank you. Next slide. So those are we are at 55 Avenue for those who are familiar with Harare, and those are our contacts and website, and we will be keen to provide more information specific for HIPH or for this collaboration and for Empower So I would want to thank everyone for listening. Over to you, Ms. Oil.
Thank you, Dr. Marume, for the presentation. We proceed now to the next panelist. Let me remind you to post your questions, your comments to the chat box. We will have a session on question and answer. Is Mr. Lemson Machibiza. He is a senior lecturer, consultant and researcher of global procurement and supply chain at Harare Institute of Public Health. He is a public health policy and pioneer trainer of trainers in pre-service and in-service procurement supply chain management in Zimbabwe. He is a member of the New York Academy of Sciences and the African Center for E-Health Excellence. He is a member of the Education and Liaison Committee of the Pharmacists Council of Zimbabwe, aligning Zimbabwe pharmaceutical training with the United Nations Sustainable Development Goals. Over to you, Lemson.
Thank you very much, Mrs. Ove. Next slide, please. The global quest for One Health, equity in health, universal health coverage, and ultimately universal health access in this SDGs era has brought to the fore the need for global, international, regional, and national partnerships and collaboration more than ever. At Harare Institute of Public Health, we capacitate public and private sector players with cutting-edge global health and supply chain skills for agile and resilient global supply chains. A Sustainable Development Goal 17 aptly sums it all: partnerships and collaboration. We partner and collaborate with all progressive, like-minded players to ensure attainment of SDGs, and the relationship with Empower School of Public Health bears testimony to our collaboration. Next slide. Sustainable Development Goal 3.8, achieve universal health coverage, including financial risk protection, access to quality, essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. For the realization of this goal, it means that we should build robust and resilient supply chains. Sustainable Development Goal number 4 aims to ensure inclusive and equitable access to and completion of quality education. At HIPH, in collaboration with Empower, we seek to provide this education in as far as global procurement and supply chain management is concerned. Also, through strengthening the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. HIPH capacitates both public and private sector players with critical supply chain skills for the attainment of Sustainable Development Goals on health. Next slide. The COVID-19 pandemic, the game changer. As McKinsey and Company aptly said it, in a time of crisis, understanding current and future logistics capacity by mode and their associated trade-offs will be even more essential than usual. Supply chain disruption was experienced due to COVID-19. We experienced unsustainably long lead times. There was no real-time data visibility, even absence of timely feedback. This sent a signal that for all countries, there is need to build country-level capacity to ensure that we have sustainable solutions to problems bedeviling our supply chains. As our Institute of Public Health, in collaboration with Empower, we seek to fill this gap and ensure that we are better prepared for future pandemics. Next slide. Those are some of the amplified global logistics supply chain challenges. For example, we experienced global shortage of PPE. This meant that the management of the pandemic was compromised. There was also global shortage of gene expert cartridges. meaning that the diagnostic testing for the management of the pandemic was also compromised. This sent pandemonium and shock amongst all countries. There was supply chain disruption, long lead times, as well as a lack of real-time data visibility. What shall we do? We don't have to wait and sit back, but we need to come up with innovative solutions. As a Institute of Public Health and Empower, we are coming up with innovative solutions to ensure that we are better prepared for the next pandemic as we seek to attain universal health coverage and universal health access. Next slide. At HIPH, our global supply chain courses are designed to capacitate both public and private sector professionals. We also advocate for real-time data generation, analysis, and data-driven decision-making being the hallmark of our training. Having skilled personnel who are using data which is not accurate will produce poor results. So we are advocating for the generation and analysis and better utilization of the data to ensure data-driven decision-making, which is necessary to ensure health commodity security and uninterrupted supply of medicines. The skills are critical for operational efficiency, not only to the public sector, but also to the private sector. The use of technology, big data, data analytics, and artificial intelligence adoption to addressing the global supply chain bottlenecks for sustainable interventions. That's the hallmark of our collaboration with Empower. Next slide. So this is looking at the modern supply chain structures. The current supply chain structures are passive in nature. There is batch processing, static dashboards, and they're not scalable. This means there is an inherent lag in response. However, we can also move on, to the modern supply chains. This is what we're advocating for as HIPH and Empower, to ensure that we have real-time visualization of data through data streaming. Next slide, please. Active analytics, the future of supply chains. Why? We need actionable insights from live data, instant data visualization, new data-driven logistics applications, geospatial analysis, which allows us to know the geographic distribution of the commodities. Where are the overstocks? How can we do redistribution activities? So this is what we're advocating for, end-to-end supply chain visibility. Next slide. Attributes of Agile global supply chains: end-to-end data visibility, real-time supply chain visualization across the entire supply chain, ethical sourcing, reduced lead times and route optimization, geospatial pipeline, integrated analytics, high performance at scale, over 1 trillion to allow for analysis, analyze as fast as you can stream, flexible deployment, market forecasting. Supply chain solutions for resilience in future pandemics are needed now rather than later when another disaster strikes. Supported bottlenecks are surmountable with the adoption of the correct technological interventions, as well as with the necessary training, with this necessary capacity building. At HIPH, we foster operational research to orient global supply chains to agility and resiliency. This is the hallmark of our partnership with Empower as we seek to ensure realization of SDGs on health by 2030. Next slide. Thank you very much. Over to the moderator.
Thank you, Lemson, for the presentation. Now it's time for question and answers. I will out the questions or comments from the chat box. Over to you, Rahul. If there are any questions, I noted that some of the questions were being answered as we were progressing. Are there any questions to the presenters?
Hi, Miss Ove.
Yes.
Right. Thank you very much for the good job you've been doing over the years. Do you, by any chance, is HIPH or Empower offer any scholarships?
Thank you very much for that question, Rahul.
Yeah, yeah. Thank you for the question. So we offer scholarships depending on your qualification. So if you need, if you feel that you need scholarship, you can definitely, write to Empower School of Health. I posted ID info at Empower School of Health, and there you can, mention your request and send us the details. The management committee will look into your request, and if possible, we will provide you a scholarship.
Thank you very much.
And yeah, so there can be a partial scholarship, there can be a full scholarship, but it all depends on your your qualifications. So definitely you can write to us.
Thank you. Are there any other questions?
So there is a question that when the master's program is expected to be launched.
From the
So so the team is in process of developing the master's course, and we are very sure that we'll be launching the course very soon. And so stay updated on our platforms, LinkedIn, Facebook, and we'll definitely send a mailer to all the participants who have participated in this conference, in this webinar. So as your email ID is now with our database, so you will come to know about the master's course very soon.
Thank you very much.
Ouais, bon, c'est pas urgent, mais quand on va vous vivre là, il gagne de j'ai verré des bureaux là, il est dommageé là, Adamu. A cari document mada autolenda de comme ça. Non, j'ai verré des bureaux.
We need a translation from somebody in the house. Unfortunately, we do not have translation services today. Can we have the question in English, please, or the comment?
Sorry, I couldn't hear you, Roba. Is there any specific question?
Yes, there was input from somebody. And I thought it was French. So I was commenting to say that today we did not provide for translation services. So if the speaker could,
we are very sorry for that. Yeah.
could forward the question in English.
Yes, it will be good if you can write the question and send us by mail in English or French. We have French courses too. So our course is also, our postgraduate diploma course is also in French. So just write a mail to us. And if somebody can write in French in the chat box, the same thing which I told, it will be of great help to everyone.
Thank you. There is a question to say, where can we get the recording for this webinar?
Okay, so the recording of the webinar will be sent by mail to all the participants. So you don't have to worry about that since we have your email IDs. So we will be sending you that. Also, to note that, at the end of the webinar, there will be a link which will be shared for a certificate. So you need to register, and you can download the certificate for the webinar which you have attended. So I'll request my team to post that link on the chat, wherein you can just click on the link, fill your name, and download your certificate for the webinar. Team, can you please post the link? Yes. So my team has posted the link in the chat box. So please click on the this link, put in your name and the details which are required, and your certificate, it will reach in next 24 hours in your mailbox, and it might reach sooner also, because it all depends on the software, how it works. So sooner you send your details in this link, the sooner you get your certificate. And if somebody has not got the certificate or the recordings by mail, they can write separately to us, and we will provide them the certificate and the recordings. No problem. Sometimes we send the mails, it goes into the spam folder, but and then so if somebody doesn't get it, please let me know.
Thank you, Rahul. There is a question for Dr. Marume to say that is the program that you were referring to in your presentation, is this program available online? Not the Empower program, but the program from HIPH. Is it available online?
Thank you. Why we have an online platform for learning, currently all HEXCO programs are not regarded as online programs, but there is an online platform for learning. So I wouldn't categorize the program as an online program, but there's an online component. I don't know if it's answering.
You have addressed the question. Oscar Vetsi, your hand is up. Oscar? Oscar Vetsi, your hand is up. Wesley, come through, please.
Hello.
Hello, we can hear you. Please come through with your question.
Yes, according to the presentation, I understand you can do employment and deployment after the course. Yes, I'm Ebukul calling from Freetown, Sierra Leone. Now, will you provide a link to where someone can submit qualifications onto when there is available publications for employment?
Welcome from Sierra Leone. Rahul, you want, please come through.
Yeah, so so what I can understand is that you are asking for a link wherein you can submit your request for some vacancies. So am I correct?
Yeah.
Yeah.
Yes, you are correct.
So we are not like Empower School of Health is basically an educational institute, and we generally have openings which generally are published, in the Indian Association of Pharmaceutical, IAPHL. I will write down the, you can join this group, IAPHL website. This IAPHL website is for public health logistician. You join this platform, and all across Africa and other parts of the country, you will keep on getting, the jobs are posted here. So you can come to know about specific country wise, jobs in this country.
Okay, okay, thank you.
Thank you very much, because the openings are flighted from time to time, and also in the presentation from Professor Pauli indicated that there are openings that are flighted from time to time. Thank you very much. There is a question, I think this is directed to Lemson, how the human-centered supply chain approach can help to establish an agile supply chain in Africa. Is there any resources or a case study available on human-centered supply chain? Lemson?
Thank you very much, moderator. Indeed, there are research grants available which can be applied for through the National Institute of Health to enable organizations to carry out research in as far as human-centered supply chains is concerned. So it will be good for would-be researchers to actually collaborate with organizations like HIPH Empower to contribute more to the aspect of human-centered supply chain approach. Indeed, it is a very noble initiative, as it allows us to orient our health systems towards universal health coverage. Thank you very much. Over.
Thank you, Lemson. There are comments in the chat box to say, one comment is, I don't generally get the recordings and certificates. Rahul, do you want to comment on that one? What one can do if they have not received the recording and certificate after a period? After how long can they follow up? Rahul?
Hi, Ropa. Yeah, hi, Ropa. I had an internet issue. So, yeah.
Oh,
so
sorry.
I had mentioned earlier, Ropa, that, sometimes the mailers go into the spam folder. So we generally send the mails. So everybody need to check their spam folder also. In case they don't get it, they can write it to us. We will send the webinar recordings and certificate. Definitely, they can just put in the details and get the download. They can get the certificates on their mail. So that's not a problem. I'm again putting the link for people to, give the details there for the webinar certificate.
Thank you. There is a comment. Thank you. There's a comment to say that may I kindly suggest you activate the webinar reminder settings for attendees to get a reminder email an hour before the webinar. I'm sure this is doable.
Yeah, that's doable, and very good suggestion, and we will keep in mind. And I'll request team to note it down that we should send reminder at least 1 hour or 2 hours before the webinar.
Mm-hmm. Great. Then from Gracia, the comment is, the site is asking for us to be signed in with a Gmail account. I only have a Hotmail account. Can you comment on that feedback?
Couldn't get you, Roba. Sorry.
It says the site is asking for signing in with a Gmail account, and the participant only has a Hotmail account.
We have not heard any such problems earlier, but if this has happened, I'll ask my team to look into that. But generally, anyone can put in any email ID and they get it, their details. Gmail is a little bit faster for Zoom, that's for sure.
And another question.
Roba, I'm just interrupting. We have the last poll left for the webinar, so we need to take the last poll.
Okay, all right. I just
and since we are approaching the timings, the close of the timing of the webinar, let's take the last poll, and then maybe we can take the questions later on if required.
Oh, sure.
I think we have done. Yeah.
That's
Last
okay,
poll,
Rahul. Yeah, we can then check the last poll, and I encourage everybody to take this poll.
Yes, participants, I request you all to take this poll, please. The last poll. Yes, so people are taking their poll, and that's good. We are almost about to reach 50% of the votings. So let's wait for a minute. I'm sure we should reach somewhere around 70%, and then we do that.
Sure.
I'm happy to inform already 50 people have got their certificates sent from our software. I'm sure people must be getting it in their mailbox. Whosoever has filled their details, they are getting it. Wonderful. Yeah, so people have written, see, Tabe has written, got my certificate already. Thanks for writing. Please check your email. Whosoever has filled the details, they will get their certificate.
Great.
In case of any issues, you can write for certificate at admin@empowerschoolsofhealth.org. So we are almost reaching 70% of the poll. Another.
Can I ask my question?
Yeah, you will just after the poll we can take.
Ask my question.
Yeah, just hold on, please.
Just one moment. Once the poll is done, you can ask your question.
Yes, I think team, we can share the results now of the poll.
So the poll from number 1 there, are you interested in a career in global health supply chain? 86% have indicated that they are interested, and 12% they are already in global health supply chain. How did you hear?
Thank you.
Yes, very much so. How did you hear about Us, 3.5% are saying through HIPH, 61% through Empower School of Health channels, 11% from MOH, and other means 23%. How did you hear about us? Part 2, in terms of the mode, email, this is 46%, social media, 26.3%, through friends or other means, 28.1%. Are you a member, alumni, member of staff? HIPH, 2%, Empower School of Health, 46%, Pharmaceutical Society or Council, 65%, FIP, 11%, University of Zimbabwe, 11%. Have you taken any courses with Empower School of Health? Face-to-face courses, 4%, certificate courses, 11%, diploma or a postgraduate diploma, 37%, not yet, but I'm interested, 54.4%. How did you find this webinar? Very useful, 77%, that's the majority, somewhat useful, 23%. Thank you very much. This is very valuable feedback. Now back to the questions.
Yes.
Oscar, was that Oscar who wanted to ask a question?
Yes, please. My name is Oscar.
Please come through.
Yeah.
Yes. So my question is, can this webinar be accredited in terms of having the CPD points allocated to it? Because some of us in the allied health profession, this program webinar can worth a lot of CPD points for us to renew our professional development pins. So if it can be accredited. And also in Ghana, for instance, supply chain is now gaining ground, but courses that are more to the people, something like MPH, monitoring and evaluation programs. So if Empower School of Health can also look at this dimension, so that it will not be more or less supply chain, but I can focus on other public health programs. Thank you very much.
Thank you, Oscar. Rahul?
Yes, thanks, Oscar. Especially, I would like to inform you that our courses are accredited from Pharmacy Council of Zimbabwe. So I'm sure the CPD points will be taken care once you show the certificate, in case you are registering in the Pharmacy Council of Zimbabwe. And other places, yes, we are looking at accrediting our courses, but it will take time. I hope I'm able to answer your query, Oscar.
Thank you very much. There was another aspect where the recommendation is to develop other courses in monitoring and evaluation. Are you able to comment on that, Rahul?
If I'm not wrong, we have a certificate course in monitoring and evaluation. Just give me a sec. We have a lot of certificate courses. I'm going to post these in the chat. So we have postgraduate diploma, we have storage and distribution, quantification, forecasting, procurement cycle, product selection. So monitoring and evaluation, if it is not there, it's a good suggestion. We take that. We'll definitely trying to put it in the next lot of courses development. So I've posted on the chat the kind of all the certificate courses we have at present for everyone to look have a look, and they can look at, and as per their interest they can apply.
Thank you. Are there any other questions?
Yeah, Ropa, we are already above timings, I think, and then yeah. So any last question to be taken, and then I think we can close the webinar. It was quite a good participatory webinar.
If there are any questions or comments that are specific to Empower or specific to HIPC, the details, the contact details have been shared. So at this juncture, I will request Rahul to make the last remarks, and so that we can come to the end of the webinar. Thank you very much, everybody.
Thank you, Ropa, and thank you everyone, specifically the panelists from HIPH, Dr. Amos, and you know, it is very kind of you that you have given us an opportunity to work under your support, under the support and guidance of Harare Institute of Public Health, and then we together will look forward for strengthening the global health and supply chain management courses in Zimbabwe. So I'm very much thankful to the participants for you know, attending the webinar. I hope it was, you know, helpful, and I'm very much thankful for the participatory response. The polling results are quite encouraging. We have posted our details both for the Empower School of Health and HIPH on the chat box. Any queries, any questions, you're most welcome to, you know, ask, and do get connected to Empower School of Health on the social media platforms for more future, you know, engagements, and we'll keep on having such webinar in future. We'll keep on sending the mailers. I hope people have got their certificates. If not, do click in to the link and get your certificate. Thank you so much, Ropa, for moderating the session, and thank you so much, panelists, for wonderful presentation. Over to you, Ropa, and then we can close.
Thank you, everyone. This brings us to the end of the webinar. Have a pleasant day, pleasant afternoon, or a pleasant morning, depending on where you are best on the globe.
Thank you, everyone.